Dr. Murray here from Back to Balance Health. Today I've got a very special guest who I'm going to invite now. So she is Kelly Lynch from Inner Work Fertility. And Kelly is a very, very special human, and I can't wait for you to meet her.
Hi, there.
Good, and you?
Good.
Good. So I'm just going to introduce, this is Kelly Lynch from Inner Work Fertility. She has a background in clinical nutrition and dietetics, specifically eating disorders. And she now focuses fully on fertility, but specifically the psycho-emotional sort of inner journey work that's required to fully approach fertility from an integrative point of view. So welcome, Kels.
Thank you.
Okay. Can you tell us a little bit more about your journey of how you kind of pivoted from dietetics to fertility?
Sure. It was a big pivot. It was actually a very scary pivot, but I look back now and I'm so happy that I had the guts to do it. I always was a dietitian that was interested in the emotional side of eating. That's kind of what got me into my eating disorder space, and then obviously became an eating disorders specialist. Emotional eating specialist is what I ride on. But it was really just about teaching people about how the emotions are always the driver of eating.
Cutting out a bit, Kel.
Are you? I've got full signal. That's weird that you can't hear me out here in the Arabian desert. Yeah, okay. I hope you can hear me now. Is that better?
Yeah.
Yeah. So I used to say to people, it's not a lack of education in 2023 that people, or 2020, it was then like 2018, that people don't know about healthy eating.
Yes.
It's an emotion that usually drives the bad behavior. Can you hear me?
Yeah.
Okay, good. So that really was my job, and I spent the days of my life then working with people's emotions and trying to explain why they were making good or bad decisions and trying to teach the behavior change around the emotions.
Okay.
And then my husband and I we got married in 2014, and we started trying to have a baby, and it just wasn't happening. I do have my VPN on for all my Dubai clients asking me that. I hope you guys can hear me. Just send me a little message if you can't. And yeah, we never, you never think it's going to be you, I think, when it comes to struggling to conceive a baby. Especially on a physical level, we were both really healthy. He is a doctor, I was a dietitian, optimized our food, our exercise, our weight, everything was where it needed to be. And yeah, we just couldn't conceive. So I was it took us just over 3 years to have a child. And what I'm doing now is very much in parallel to what I learned in those 3 years. So that's how the pivot happened.
Okay. Yeah. Okay. And so you've now transformed this into an online course that you offer.
Yeah. So the course, I think before I explain my course, I must just explain my philosophy when it comes to fertility. I think one of the beautiful analogies that I always share with my clients is that everyone's fertility journey is it's almost like a puzzle, and you don't know how many pieces that puzzle contains when you begin the journey. Some people have like a 2-piece puzzle. and other people have 1,000-piece puzzle. And you never know until you get to your child how long and how big that puzzle actually is. So I in obviously being Western trained in the medical world, both of us, is there like a echo for you guys as well, or is it just for me? Okay, can you hear me fine? Okay. I'll just carry on talking through my echo. Yeah, having this Western training, both of us, and obviously trying to have a child, and every month everything not happening. We kind of cycled through the physical plane and the physical treatment, and we, hormone optimization and Clomid and Femara cycles and sperm analysis and all of that. And no one ever delivered any of the other stuff. Now, as an integrative doctor, I'm sure you very much believe in the fact that the human body is not just a physical entity, that our emotions and our mindsets have a powerful impact. And how,
Bio-social spiritual model is what integrated medicine's based on.
See, and for me, that's why integrative medicine is so great, because that is relevant in every single imbalance or disease in the body. Like you can find, and that's really, I didn't know about this at the time, and so I spent so much time and tears and hours trying to figure this out alone. So I like to explain the emotional, so obviously your physical body is your physical body, but your emotions have a massive effect on your physical body. And a good way of explaining that outside of the fertility space is if you are sitting at a concert and someone sings a beautiful song and you get goosebumps on your arms, that is an emotion in your body that you felt that has had a physical reaction on your body, on your skin. Like you're not cold. It's not from, it was like just such a beautiful moment. So so they talk about neuropeptides, and I go quite into them in my course they talk about neuropeptides being the molecule that kind of moves the emotion from the emotional into the physical body. And so neuropeptides are like the emotional link of how that affects your physical body. But then obviously your belief systems and your mental side and how you think also affects your body. Habit is a good example. Like you can literally not ride a bike for 20 years and get on a bike and ride a bike. Like your mind can affect your body. Your body remembers how to ride a bike. So your neural programming is obviously also a massive part of disease or imbalance, and how we, there's neuroplasticity and how we can shift that. But if that's like factual on levels of human existence, when you look at someone struggling to conceive, we obviously need to address the emotional and the mental side of someone, especially if the physical is fine. And that's often the type of person that comes to me. That was me. There was nothing the doctors could find that was the imbalance. And a lot of my patients say to me, I wish there was something wrong with me. And I know because that high achiever would go and fix that. But I always say, if there's nothing wrong with you, we can leave the physical and then we can focus on the emotional, mental. And then the spiritual for me has always been a very big part of my life. But what I love about the spiritual is even your top fertility doctors in the world will say to you, there's something we can't explain when it comes to an embryo, a double A grade embryo IVF transfer, and it doesn't take, to a naturally conceived baby with one fallopian tube on a contraceptive pill. And they're like, we don't understand. So the spiritual is a huge part, and I often like to use the other word as intuition rather than spiritual, because spiritual's got a bit of a scary connotation for many people. So just creating that ability of a mother and father to connect to their unborn child, and to speak to them, write to them, pray to them, however, whatever works for them. So that's like my belief system, and it took me 3 years to figure this out, and that's what I've now done and put all those tools into my course.
Okay. Wow. Jeez. And it's it's just so beautiful because exactly you've got that what we call psychoneuroimmunology, and this is what I talk to patients about as well. You know, if we're struggling with chronic illness, chronic fatigue, autoimmunity, there is that that other element, and often, I mean, autoimmunity is well known to also be the kind of high achieving type A. I mean, myself included. It's fascinating.
Fertility, the type of girl that works with me, and I really try my very best not to box, because if you are struggling to conceive and you are like a very chilled personality, it doesn't mean that that's not valid, but it's not often that I see someone very chilled. I always say I work with myself all day long. I look at myself every day in the Zoom call, on my Zoom calls, not really me in my clients. And it's generally your very high achieving woman that will be working with me. They've often done everything. I mean, I always say I used to get the conscientious award at junior school. Like, that's the good analogy for the type of girl. Like, if the teacher says, huh?
No, I just wait when you finish, when you're done with this next thing, let me know.
No, tell me, that's what
it just keeps coming up because some of your posts are the woman who, or not the woman who, but whoever did, putting the time to the minute on the pregnancy test. Yeah. I mean, I thought, diligent, conscious, but I mean,
And if the doctor says you must inject at 11 o'clock, it's not 11:01 and it's not 10:59, it's 11. And that's, that is and this is the thing. I mean, these women are high achievers. They work they've done well in their lives, like in terms of how society, assesses our success in our generation. That's another Instagram live we could talk about. But I think it's very important to see that with every strength, there's always a weakness. And so this is why inner work is good and powerful for high achieving women, is because you can't achieve inner work, but you can do inner work, and it runs parallel to all the things you are working at in your life, if that makes sense, alongside fertility treatment, or no fertility treatment.
Wow. Yeah, very good point. I mean, all of that journey work that you're going to be doing on the course is applicable to every sphere in your life. Yeah.
Well, this is what a lot of people say once they've done the course. They say that what they learned in the course, we obviously can then implement into various other sort of areas or like problems in your life. I think once you understand the power of the way, like I talk in my course about outcomes, and it's really important to know what those outcomes are. So I had a girl yesterday, she said to me, I'm starting my first round of IVF. Now, when you think about the language that she chose to use, she's already failed the first round in her head, because in her, like the way she's thinking of it, she's expecting more than the first round. And often, like if you're on the fifth round, it's about changing the outcome, because you have to work at that. You can't just, it's not just hope. We need to use and this is what the course gives, like how to do the neuroplasticity, how to see those outcomes, how to feel those outcomes, or how to implement them into your life. It's very important. And I always say to my girls, we have multiple outcomes on a fertility journey, because someone that's maybe had 3 miscarriages, her biggest fear is sitting around 7 weeks pregnant, because that's when it all went wrong the last 3 times. Or someone else who's been told that their mom nearly died giving birth to them. Their fear is sitting in birthing this baby. So and fear and pain are big words that I use in the course a lot, about how the body avoids and aborts and doesn't want to go there. And how we shift that.
Yeah, fascinating. Wow. Okay. And Kels, okay, there was one thing I wanted to, your puzzle pieces. That's, it's such a good way of looking at it, especially because obviously, with fertility issues, you are going to kind of exclude you'll start with the physical, so excluding any medical conditions that might be contributing and that type of thing. But once that is obviously all clear, and I think that's the most frustrating one, is when you're kind of told there's nothing wrong with you, it's all fine, and now IVF is the next step. And so then getting to you with this kind of getting told that you're all fine, and then you just want those answers. So getting that puzzle picture or puzzle pieces, that's really good.
And I always say to everybody, don't ever disregard any of the pillars. So those 4 pillars that I spoke about in the beginning, you obviously have your physical pillar, your emotional pillar, your mental pillar, and your spiritual pillar. We have to keep working on all of them all the time. Not like you don't just put your hands up and not go to a doctor and get an assessment. You don't just put your hands up. We have to. And I really love working alongside a fertility doctor. That for me, because then a lot of their beliefs are not aligned with mine, but I can align my beliefs with the client, because she's got more invested in the outcome, of course, than a doctor has you seeing 15 patients a day. Like if he says to her, your AMH levels are the problem, I'll say to her, as long as there's AMH, you can have a baby. Like, you're still fertile. So let that one go. But he's checking, there's a massive place for all the role players here when it comes to fertility. And we need to make sure, and this is why I did the course, because I felt like there wasn't anyone to talk about the emotional blocks I had in fertility. There wasn't like a fertility psychologist and a fertility neural linguistic programmer. So it's kind of my version of those things put into one place that I say should run alongside your physical. You still must be eating well, and you must supplement, and you must make sure you have your tubes are open, and your hormones need to be optimized, of course, but it should always be running parallel to the physical.
Yeah, absolutely.
Yeah.
And tell us more. So what are some of the sort of tools or techniques that you use to kind of help people access that
so
sort of?
Yeah, so again, none of them really have names. They're all my own sort of figuring out. A lot of it people would have read before in like bits and pieces, but one of my biggest and most powerful tools that I always begin with, and it's actually a free download on my site, so I'm sure some of the people listening have already downloaded it, but we need to know where the fear is sitting from the very beginning. So there's a circle with 4 quadrants on that document, and the first quadrant is labeled conception, then pregnancy, then birth, and then motherhood. And obviously for your husband, it would be conception and fatherhood, normally for a first-time dad, because they often don't have a point of reference when it comes to pregnancy and birth. Whereas if you're battling with secondary infertility, that same quadrant is relevant to him. It just says fatherhood, not motherhood, because a lot of men will have blocks. Like if you've had a traumatic birth with your first child, your husband could be terrified that he might lose you or the baby, and that could be a block, when an emotional block on his side. So that quadrant is a starting point, and I always say, imagine you had a coin that said fear on it, and you have to put that fear coin down on one of those quadrants to start, and that's where we begin. And that, you know, my high achievers will say, can I have some more coins? Which is great, but I'm like, what is the one that's jumping first? And that's the starting point. And then we journey through the emotion and the mental. It's almost like we figure the emotional blocks out, and then we use the neural programming to shift those emotional blocks.
Okay. Wow. And which quadrant is the most common?
It's such a good question. Do you know which one it is? Motherhood.
Is it
most common?
Very interesting. Yeah.
Very.
Sure.
Yeah. I'd say birth is probably the most common.
Okay.
I think there's quite a beautiful birth empowerment movement in our, you know, there's a lot of like women really feeling like they like want to do that primal thing. Secondary infertility, the main block is birth.
Oh wow, really?
Yeah.
Okay.
So
okay.
Yeah, I mean it's
generally women who had a traumatic birth, or
yeah, and they haven't processed it. Because to be honest, I mean, we know as young mothers, not physically young, but are mothers of young children, there's no time to process birth trauma. You have a baby. There's no like, come and let's, you know, cry it out, and you have a young baby as well. Yeah. So birth trauma is a massive part of what I do when it comes to secondary infertility. I mean, I'm certainly no expert in birth trauma, but I can identify it, and I can obviously if it was really bad. I mean, I had a client once whose placenta and umbilical cord snapped, but the baby was out, but the placenta was in and the umbilical cord snapped, and her husband, he's still in therapy about it, which is great. He needs to be, and he's really on the right path. And I think this is also something very important to talk about, is so much of the fertility stuff is placed on the female. You know, we need to do it all, sadly, other than a sperm analysis. And then the doctor will be like, A grade sperm, he's perfect. And then again, it's like the load onto the mom. I think we need to, and I really try, not all partners are keen to chat to me. They're scared, which is totally understandable. But I often use the mother as a portal to get the information through, and to sit with the work that we do, and the coursework and the meditation that the course you know, gives, and do the meditations with him, and, you know, read or listen to the course content, you know, on a long drive or whatever, because it takes one egg, but it also just takes one sperm, and it's literally 50-50. And just because it's in the female's body, she takes more of the responsibility, but prior to conception and in the struggling phase, it's equal. And very important conversation to remember. You know, it's not all.
Yeah. I've done that a lot. If we're working in fertility, then generally I do a couples consult at least once, just to check in. And you know,
you know, you can trace it often back. You know, I do the maternal line. It's quite a big one in the course, and I'm a big believer in like healing your maternal line. And you can go, you know, for the men, and talk about their mother and the role their mothers played, and you know how she used to speak about them as babies, or how her pregnancies or birth, or she was a single mom and she struggled a lot. And you know, the subconscious mind will see that and be like, that equals like motherhood or fatherhood equals difficult, equals scary, equals avoid at all costs. But it's a subconscious thought. Obviously, they're now happily married and they want a baby. So it's about trying to find, it's like mining. You almost mine for those puzzle pieces. That's really, but you have to do inner work to find them.
Exactly. Yeah, you got to tap into the subconscious. Yeah.
Yeah. Yeah.
And I just want to check here, there were some questions, but the one was just on more sort of preconception cycle mapping. That was just the one thing that someone wanted to know a little bit more about. Do you go into that a bit?
Yeah, I think cycle mapping is so important. Preconception, optimizing your preconception health is so powerful. And that's why, like, if we can scream it from the rooftops, we must. Even if once you start deciding you want to have a baby, let's optimize your physical body. Let's get your head right. Let's, see this baby into reality. But cycle mapping is absolutely 101 of it all. You have to understand your cycle. One of the girls asked a question about, getting your cycle back after birth control. It does generally take about 6 to 8 months for anything to be back in some sort of rhythm. But they talk about your period and your menstrual cycle being your 5th vital sign or 6th vital sign. Yeah. And so it's such insight into as is your pulse, as is your respiratory rate on your health. So if you are having, and like what is normal, it's more about what is your normal and the rhythm that your body has. I always say the rhythm or the cycle length is, for me, like if we have continuity, that's a good sign. If you're having like a 22-day cycle, then a 39-day cycle, then a little bleed, then a hemorrhage bleed, then we need to check that out.
Yeah.
So yeah, and using your apps, your Garmin watch, like just cycle map, it's so important. And in terms of your cycle, but then in terms of fertility, I'm not a believer in ovulation sticks. I really don't like them. They're not good for the psyche of a high achieving woman. Okay. They made me go psycho. That's why I try and avoid giving or recommending them. But teaching women about cervical discharge is so important. And I know it's a gross word and everyone goes, oh my God, I want to talk about it. But it is when your body is telling you are fertile. So knowing what ovulation discharge should look like, how, the ovulation discharge, and then you're fertile, having sex every second day for the 5 days post that is so important. And basal temperature monitoring is also one. It can also make you go a little bit cray though.
That would be ovulation with thermometer.
No. Well, yeah, so a lot of them put it in their mouth and they just do it in the morning and next to their bed. But then it's like, did I leave it in did it be just too much analysis? Whereas I just say, look at the toilet paper every time you wipe on the toilet, and that is the best way of knowing. And making sure your fluid intake is at least 2.5 to 3.5 liters every day. Any girls that are doing fertility treatment will tell you that is one of the first things the doctors tell them is to get the fluids up. A dehydrated body isn't necessarily going to have a cervical mucus discharge, or it could be very like drier and it won't look like it's meant to. It's meant to look like a clear egg, raw egg, not cooked egg, raw egg white. And that's when you're at your most fertile. So knowing that is really number one for sure.
Okay. Thank you, Coles. We are at our time limit.
It's such a pleasure.
You are such a wealth of information. Really.
Well, I think it's just because this was my life. This was my own journey, and I think that's the power of this work now for me, is that I am the person sitting in front of me every day. So if anyone is listening and wants, please feel free to message me on Instagram or email me. Always a pleasure. And thanks for having me, Dr. Leah.
Oh, such a pleasure. Thanks for joining.
Okay, we'll chat soon.
Good luck there without your nanny.
Thanks. Only a few more days. Thanks, Lee.
Bye.
Bye.